Emergency personnel of Reddit. What's the dumbest situation you've been dispatched to? Not quite in the same vein, but I worked at a vet clinic that received a report from the local overnight emergency vet for a dog the owners thought was having a seizure in the middle of the night. The dog was diagnosed with dreaming. That's adorable as crap. Briefly shadowed a small town fire department. Lady called in that some dude was impaled by a branch while pruning trees. Rushed over there. It was all makeup. They were shooting a film. All the neighbors had been notified but she forgot apparently. Got called for a child who her grandfather and legal guardian was actively abusing her. Notes said screaming and crying was heard in the background as well as "don't hit me again" and "he's trying to kill me." Turns out a 12-year-old girl had snuck to go see her 20-year-old boyfriend and came back drunk and stoned reeking of weed, and when her grandfather tried to punish her by taking her phone and grounding her, she grabbed a knife and tried to stab him. In the process of disarming her, he pushed her backwards and into a table, knocking a lamp over. It was at that point she grabbed a phone and barricaded herself in a room and called 911. I'm not the emergency personnel in this situation, but I called 911 because I found my neighbor, an elderly lady, lying on the ground outside. She was slurring, unable to get up, and generally dizzy looking. I thought she had a stroke. They got there and were talking to her for a few minutes before telling me that she was just drunk. Calling was smart. If a diabetic's blood sugar gets too low, their symptoms mimic being drunk. During one of my 24 hours ambulance shifts for EMT basic training, we got a call to a big lots for a laceration on a finger. It was essentially a paper cut from a rough edge of a chipped candle. I got to practice my EMT skills by applying direct pressure to a non-bleeding index finger. Even got to put a band-aid on it. The girl was acting like she could not look at her finger and was going to pass out from all the blood. The gauze strip I held on her finger didn't even have a spot. "Don't worry," she sued. Seriously, she did. I got called for a woman experiencing stomach pain, which she calmly claimed was a 10/10. Must have been quite the trooper since her husband drove her 30 minutes across the county, past the hospital and 2 urgent care centers, to let her mom look at it before calling the wee-woo. For someone who had been freaking unprotected for 7 months, she sure was confident she wasn't pregnant. The nurse who had to explain to her the way these things work was right on the corner of Amuse and P. Before calling the wee-woo. LOL. Never heard it referred to as that. Upvote. Not your typical emergency personnel, but I work for a commuter railroad and I get called out to inspect the equipment when there are pedestrian vehicle strikes. There was a couple making out on the tracks and saw the train coming and decided to play chicken to see who would bail first. The girl lost both the game and a leg. A mother called 911 because her son spilled a bottle of Tide soap and was walking in it. She even called poison control before she called 911, and poison control told her there would be no side effects. The only advantage was the whole house smelled like lavender. My favorite part about this is that her entire adult life she assumed she was putting poison on her clothes to wash them. 20-something-year-old guy called 911. He bought new shoes a few days before. They were too tight. His feet hurt. He was still wearing them when we got there, but I successfully extricated him. Dispatched to a child with seizures, who had a history of epilepsy. Got on scene and the kid was coming out of his seizure and was post-ictal. Packaged the kid up to transport to the hospital and his mother is screaming at me that he must have his peanut butter balls. Not sure what she meant. I asked her what she was referring to. His peanut butter balls. He has to have them. I have them in a jar. Here, take these peanut butter balls to the hospital. She hands me a small pill container. I look at the label and read that it is phenobarbital, a common anti-seizure medication. I asked the mom if this is what she meant by peanut butter balls. Apparently she never read the pill bottle label and misheard the doctor pronouncing phenobarbital as peanut butter balls. I realize this is the second post in one day where I have referred to peanut butter. I consider it far more likely that the mother is one of the many adults who have successfully concealed that they are illiterate. Guy moved out into the country. His 1-2-acre lot was surrounded on 3 sides by farm fields. Come harvest time, he calls 911 and blocks the farmers' access to their field with his vehicle. Wants me to force the farmers to stop harvesting because when he leaves all of his windows open, the inside of his house becomes dusty. Whoa. Seriously, frick that guy. Harvest time is already time sensitive. He probably cost those guys a lot of time with their families that they had to waste dealing with him. As someone who can look out my window right now and see a soybean field and a cow grazing in a pasture, I can attest to the fact that harvest time is a bee sometimes. But damn it, that's what you get for living out here. Dispatched for a very strange gas-like smell in the backyard. We got there and walked around with our sensors. All levels were normal. Well miss, everything is normal. What's that smell then, she asks. All we smell is some mulch. She exclaims, is that what that smell is? They just had mulch put in behind us yesterday. How long is that smell going to be around? Are we going to have to keep our windows closed for that long? I'm sure I could come up with many more, but that one sticks out. Lady with Alzheimer's called 911 for a spider in her kitchen, but described it as someone in her kitchen. As if that isn't silly enough, the spider didn't even end up being a spider. It was a dead fly on her windowsill. She needed a bird to catch the spider to catch the fly. Firefighter and 911 dispatcher here. Once as a dispatcher, took a call for suspicious activity. What was suspicious? There was a bicycle in the front yard of her neighbor's home. She told me, I've never seen a bike there before and it just seems weird. We didn't even bother to dispatch that one. As a firefighter, once during a huge rainstorm, we were dispatched for a vehicle in the water. This intelligent gentleman has decided to try to ford a river that was several foot high in his small Toyota car. With his girlfriend in the vehicle, he drove into the water and predictable got stuck. He immediately jumped out and swam to shore, leaving her standing in the trunk with the vehicle stuck at an angle upward in the water. As we got his girlfriend out, he tried to pass it off as her fault. She slapped him, and none of us said a word about it. Another time we were called to a police assist. When we arrived on scene, the officer directs us to the guy in the back of his cruiser. The guy shows us his finger and says it hurts. The finger is covered in a paper towel held on the finger by a rubber band. When he removes the rubber band, we see that the top 2/3 of his finger has been amputated and has been unattached for a couple days. He had just been walking around with his amputated finger held onto his bloody finger stump for a couple days and just decided when he was being arrested that that was the time to deal with it. The river is too deep to ford. You lose your girlfriend. Press spacebar to continue. My sister was a dispatcher and she would tell me all sorts of dumb calls she got. I'll tell you guys one of my favorite stories she told me. One time my sister got a call from a woman reporting that a man robbed her during a H deal. Apparently her dealer ran off with the money and gave her some random substance that doesn't get you high but it looks like H. The woman was being serious and acting like she was getting unfair treatment from a legitimate legal business. The woman is a sheltered middle-class woman from the suburbs. She was genuinely surprised that anyone would have the audacity to act that way in that kind of situation. She wanted that man arrested and wished to sue him. According to my sister, she had the I demand to speak to the manager attitude over the phone the whole time. I wouldn't believe this, but I work retail in the suburbs, and I know better. People can be really freaking stupid. Paged at 3 AM for an ill person. So I'm already tired and being sent to something vague isn't what I want. Arrive on scene and walk to the front door. Middle-aged guy opens the door and looks absolutely terrified. He rushes us in and we ask what's going on. He replies, I have the hiccups. Partner and I are exhausted from a rough 24-hour shift and we are incredibly confused. We ask him to clarify and he explains that in his 40-odd years of life, he's never had a case of the hiccups and is absolutely positive his life is in danger. We do our assessment and then explain that it's normal and really doesn't require the ER, much less us. He demands that we take him to the ER, so we oblige. When I called in the report, the hospital asked me to repeat the chief complaint 3 times. We were kicked to Tridge the second we walked in by some very annoyed nurses. Luckily they understand that we cannot refuse transport if the patient has a complaint and wants to go. Dude was absolutely fine. Paramedic here. Dispatched to a man with a groin injury. Arriving on scene, I found a 30-year-old man doubled over in pain and bleeding quite heavily from his crotch area. Long story short, he wanted to see what happened if he put peanut butter on the tip of his dong and let his Rottweiler lick it off. I think he was partaking in some sort of masturbatory thing. and wanted the dog to give him a form of oral. I controlled the bleeding the best I could and got his butt to the hospital. He underwent microsurgery to try to save his mangled dong, but I understand that it was unsuccessful. Also, the part of his penis that was eaten by his peanut butter loving dog was resting comfortably in his dog's digestive tract. Dog swallowed a good chunk of his dong. Can't make this stuff up. Not sure if it was chunky or smooth peanut butter, which was the first question my chief asked me upon returning to headquarters. Microsurgery. I see what you did there. Got dispatched to a nursing home for a guy who was pulseless. Arrive on scene to find the nursing home staff doing CPR on a guy who had been dead for at least 6 hours before they found him. They couldn't understand why we called it after hooking him up to our monitor and finding he was asystole. Then didn't understand why we weren't gonna transport him to the hospital. Dumb, but tragic situation. Courtesy my EMT best friend. Take it away, T. Things learned from a patient with CC. A spider bite on my butt. 1. If normal shit you'd play just isn't doing it for you anymore, the obvious solution to this problem is to order a fancy, exotic tarantula from a fancy, exotic tarantula seller, and then proceed to somehow coax and or shove said arachnid into your rectum. A more accurate CC would have been spider bite in my butt. 2. Spiders become very upset when this happens, and they will bite you multiple times before expiring. Lost somewhere in your lower bowel. No, EMS will not look for it for you. The pay grade isn't nearly high enough. Some things are best left to physicians. 3. While it is helpful to know the exact species of said spider you've shoved up your ass because YOLO, this information is not very useful when you've waited 3 days after being bitten to call the boo boo bus. 4. Yes, that anal discharge is not normal. Yes, it is probably related to being bitten by the spider. Jeez. No, it will not go away on its own. No, there is not something you can put on it, but thanks for noticing the 4 external use only instructions on the bug bite cream. Guy ended up losing everything up to the transverse colon. Not sure exactly what he was going for. Sadly, all of this might have been a little easier to understand if he had irradiated the spider first. Poop in a bag man is not nearly as catchy as Spider-Man. So he'll shove a spider up his butt, but external use only bug cream is where he draws the line. Tone to a residence for uncontrolled hemorrhage, possibly to a dangerous part of the body. So my partner and I roll the medic unit rolls, the volunteer fire dept rolls, so we have 9 people respond hot to this house. Stroll in and see a kid sitting on the couch holding a Kleenex to his hand. He cut his finger on a soup can. It was what I would describe as a very aggressive paper cut. The kicker, they were literally across the street from the hospital. Apparently the kid's uncle had a track record of abusing the system a lot. Another one, we got a call for a psych patient, acting erratic and talking to herself. Turns out she was perfectly fine just chatting to someone on a Bluetooth headset. Not a paramedic but work in healthcare, and they train us in emergency care at university. Guy told us on a training day that they were dispatched to a house after a woman called in hysterics claiming her baby had been violated. Turned out her pet dog was mating with a neighbor's dog in the back garden and she got upset when she saw it. That so sounds like my aunt. 45-year-old male locked inside car called 911. My buddy responded to tell him to unlock it then try the handle. Another life saved. My ride along during EMT school had to have a certain number of hours spent working with a rescue squad. On a slow night, our third call was of a shooting that, at the time, had the victim in critical condition. We responded and come to find out, the victim put on a bulletproof vest and told his GF to shoot him. Well, she did, and missed the vest completely. Poor guy died later at the hospital. No alcohol involved either. That's stupid. Even if you hit the vest, you ruin it. Kid got his head stuck in a fence. Then he got stung by a bee. Everyone present that day, including the kid, found out he was allergic to bee stings. So then they had to resuscitate him. Good times. A man on PCP who broke into an apartment, stole a pair of women's panties, changed into them, was discovered and chased away by the woman's boyfriend, and we found him running around the neighboring abandoned lot wearing nothing but said panties. Dispatched to illness for a 90-some-odd-year-old woman. She stated that she had eaten 2 bites off leftovers and then realized they were leftovers and wanted us to induce vomiting. We are a BLS unit. We don't do that. Which we explained. And her pee-off daughter freaks out and is yelling at the mother about how she made the EMTs come all the way out here. And now she is going to go with us to the hospital to get her stomach pumped at the hospital. We stopped her right there. ADN explained that the hospital isn't going to perform a painful and unnecessary procedure over eating leftovers. It ended up being a refusal and we didn't take her to the hospital. Also in my city, units were dispatched to reports of a body in a dumpster in the wee hours of the morning. Upon arrival they discovered that the body was actually a Justin Bieber standee. Well, don't just stand there. Resuscitate the Justin Bieber cutout. 911 call for a 4-year-old who had a nightmare. Parents called specifically for a nightmare, and that was how the dispatch went out. Not trouble breathing, not possible seizure, etc. Thought of some others. Unconscious child. Arrive on scene to find a kid laying down on the floor in a store. No history. Full day of school. Was running around the store being a brat when he was reprimanded. Promptly fell out. Definitely responsive to pain. Pupils are good. So I loudly announce we're going to have to stick him with needles and draw some blood. Give him fluids. Patient regained consciousness and tried to run away. Unconscious diabetic. Get on scene and there's a woman laying on the couch with sugar sprinkled on her. The woman's son knew it was a problem with low sugar and figured he'd try to help. It would have been super cute, except the kid was 16. Please, everyone, educate those around you if you have chronic health problems that can become emergencies. One patient that wasn't mine but came in on another unit while we were waiting for triage. 17-year male couldn't get it up with his girlfriend. Insisted that nothing like that could ever happen, so something must be wrong. They call 911. Get transported, make it to triage and get promptly sent out to the lobby. The nurse, as they are walking away, says to us, someone needs to show that girl how to use her mouth. My husband was a cop. He got called out to an active domestic one night about 2 in the morning. Gets on scene. Guy comes out and says his girlfriend assaulted him with a weapon. Turns out she threw a hot pocket at him. The most devastating of weapons. Simultaneously frozen hard and molten hot. Easy one. Got called for a woman who had a miscarriage on the toilet. Show up, and it's not a miscarriage, just a big nasty turd. Nope, no dead baby, just a miscarriage of judgment. Bad and parching. So I worked for an EMS crew at a major university. There's one event that happens every spring where the undergrads get absolutely shithoused. I've never consumed more alcohol in a 24-hour period than as a student during one of these spring flings. We got dispatched for a naked drunk kid, which wasn't dumb by itself. No, what was dumb was that by the time we arrived, the kid had run off. Then we head back to base, and every 20 minutes or so, we get that call for the same kid in a different location. This goes on for a few hours, and if you plot the locations we were called to, you could see him inching towards campus. We finally found him passed out in the freshman dorms. You made it home. Hooray. My dad is a firefighter. He has a regular who calls 911 because they get stuck on the toilet. No, they didn't fall in or get their intestines ripped out by flushing. They are so large that they lose feeling in their legs that they cannot get off of the toilet. He knows the guy by name now, and my dad says he is a pretty nice guy. He just needs to not sit on the toilet for so long. I can just see how that call goes. Hey Bill, it's Frank again. Yeah, it happened again. Okay, yeah, see you in 5. Say, can you stop at 7-Eleven and grab me a big gulp? Sent to a lady whose 2-year-old kid had licked a baby wipe, like touched it to his tongue. Then he made a face and went on with his 2-year-old's day. Best part was that mum was a nurse and thought it might have burned his lungs. Ridiculous. As a nurse, this bothers me. Several years ago, when I was a paramedic for a volunteer fire department, we were dispatched for a possible heart attack. Arriving upon the scene, we grabbed all of our equipment and started to run towards the house. We were stopped by the house's owner, who was screaming, "She dead, she no move," and pointed towards his car. He had called 911 because his car's battery was dead. Responded to a medical alarm, that is, life alert, activation. with the patient not responding to the dispatcher's questions. Turns out it was an old lady who wanted someone to fix her TV. You're goddamn right, we fixed it. Cop here. Got dispatched to a woman in labor at 3 a.m. Arriving on scene and realized I had been there before with social services before because the neighbors had smelled the apartment through the walls because of all the buildup of garbage. Got into the place and the lady is running around with nothing but a Motley Crue t-shirt on and she's screaming that the baby is coming out. Bear in mind this gal looks like a yeti and it smells like one took a dump in the middle of the apartment. I knew right then that I wasn't going to get down there and play catcher. My germaphobe partner is standing with his hands as close to himself as possible trying not to touch anything and says, wait, I got this. How far apart are your contractions? She says about 3 minutes. I ask him what does that mean? He says with a blank look on his face, I don't know, I saw it on TV. It was about -30 out that morning, so I tell Labor Yeti that she should probably put some pants on because the ambulance is on its way. She grabs a pair of vintage Zubas out of the closet next to the door and puts them bad boys on. I go upstairs to get her 4-year-old daughter ready to go to the hospital as the ambulance members arrive. They head out the door with Labor Yeti and all of a sudden I hear that they're en route to the hospital with mom and baby. I get to the hospital and ask one of the EMTs what happened as he's hosing out the ambulance and he said that she lifted up a leg to step into the ambulance. She stops and says something fell out and all of a sudden they hear crying. They rushed her into the ambulance and cut the baby out of the Zubas and got her to the hospital. And bam. The story of Sweatpants Baby was created. A nurse here had a call for a patient who came in by ambulance for a flare of restless legs. Not even the stupidest call I've seen. But the most infuriating thing about it was they called themselves rescue to their house in the middle of one of our crazy New England blizzards. The kind where we had literally 3 feet of snow and a state of emergency with driving bans and essential personnel mandated to make sure there were people to provide patient care. I brought a crock-pot meal and packed a bag, so didn't really care. I got paid OT and had electricity, so it was pretty okay as far as I was concerned. But these poor EMS medics risked their lives every minute they were on the road to transport a patient with restless legs. I would have been less irritated if the patient was demented or otherwise not in their right mind to know how not emergent this type of call was, but they were completely with it. May have done it just to get a path through their driveway shoveled for free. An EMT friend says they get several of those every heavy snowfall. I was once dispatched to a woman who needed a band-aid. She had no working lights in her house so she didn't want to get up and look for a band-aid. My dad is a volunteer fire captain. I was at his house and he got a call for a guy that flew a powered paraglider, like a go-kart with a big fan pushing it whilst being suspended by a parachute, into a tree. I went on the call with him and the guy was stuck in the top of a tree with a broken ankle. It took hours to extricate him. 4 bonus points. The tree was in the yard of a trailer house with some very hillbilly people, so there was a constant circus of guys in wife beaters and women in muumuus yelling at each other. When you said flew, I thought you meant had to drive really fast into the tree. That's amazing. Not EMT but work in emergency. Lots of stories, but one woman was waiting in the waiting room for a couple of hours after self-presenting. She started getting crappy with the wait, so went outside onto the street and called an ambulance. They came and brought her back inside but through the ambulance bay and wanted to be triaged again. Her initial triage was logged as did not wait and the retriage with a new time but the same category and then sent out to the waiting room. Her thinking was that if she came in by ambulance, then she would get a bed straight away. Nope, she just had been put to the bottom of the list again. I grew up in a family of medical professionals, and I was always taught that if you go to the ER and they don't make you wait, that's when you should be scared. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.